Good day everyone. We are here to present a study about COVID-19 pandemic influence on healthcare professionals, to be presented by Ms. Ariate, Mr. Fideli, Ms. Haron, Mr. Macabago, and Mr. Suligin, students from BSN Level 1C. Overview. Since the pandemic started back in 2019, people are alarmed and overwhelmed by the happenings. On the earlier part of the pandemic, people are focused on the people who are infected by the virus, but somehow, over time, people also notice that our HCPs or healthcare professionals are being overworked and stressed due to the pandemic. The aim of the study was to examine alcohol intake, sleep disorder, and depressive symptoms of HCPs during the pandemic in comparison with the pre-pandemic period. Another goal was to indicate risk factor for mental state deterioration and an increase in alcohol use. Also, a cross-sectional survey was conducted, and it includes Beck Depression Inventory, Social Support Scale, Athens Insomnia Scale, and Alcohol Timeline Followbacks.
This part is to explain the objectives of this study. While SARS-CoV-2 was spreading in Poland, the influence of the situation on the mental state of healthcare professionals was explored. The study aims to research whether insomnia, alcohol intake, and symptoms of depression were influenced by the COVID-19 epidemic among healthcare professionals. Moreover, the study aims at identifying factors related to alterations in mental state. It was examined whether changes in the above-mentioned factors were associated with the gender, age, education, living alone versus with someone, employment status, income, individuals, and their relatives. To achieve those goals, current depressive and insomnia symptoms as well as alcohol intake during the COVID-19 pandemic were examined and compared with the depressive symptoms, insomnia, and alcohol consumptions reported prior to the start of the pandemic. Pre-pandemic and post-pandemic outbreak assessments have been conducted simultaneously. The longitudinal evaluation of the mental health symptoms was not performed, as it was impossible due to the unexpected nature of the COVID-19 epidemic. It was hypothesized that there will be a significant change in the mental state and alcohol consumptions of the studied individuals as the effects of chronic stress unfold. Based on previous research, we have indicated possible factors linked with mental state alteration and further examined those factors. The objectives are able to provide the aim of the research. The factors stated resulted in a positive outcome as the research was conducted right due, but the effects of it to the people about the situations applies to be negative, as it results in a negative impact to the health professionals. Furthermore, the objectives applied to the respondents and were proven based on the survey and were written clearly and understandable.
After reading and studying this research, we were able to list these predictive hypotheses. Hypothesis number 1. The factors such as insomnia, alcohol intake, and depression symptoms could affect healthcare professionals during COVID-19 pandemic. Hypothesis number 2. The result provides a positive outcome as the research conducted a survey during pre-pandemic and during pandemic. Hypothesis number 3. As the situation complies, it also increases all the factors to affect the health worker because of their work and the situation they are facing. Hypothesis number 4. Alcohol intake could be a part of coping mechanisms of some professionals due to stress and fatigue. Hence, alcohol was banned for safety reasons. Lastly, hypothesis number 5. The increase of insomnia and depression could also happen because of the sudden changes and the life that was take to them could build pressure, stress, over-fatigue, and lack of composure.
This part explains how the researcher gathered respondents and information. First and foremost, before executing the process of gathering information and respondent, brainstorming is happened. Letters and consent are done properly and in a clear manner. Also, questions are being formulated. After getting the respondents' consent, they are able to answer the question online. It is done this way for a safer and time-efficient way. The healthcare professionals group consisted of 188 participants recruited among those medical professionals who work with patients infected with COVID during the study's course. The healthcare professional group consisted of 188 participants recruited among those medical professionals who work with patients infected with COVID during the studies course, and the respondents are gathered through snowball method. Next, the data were analyzed anonymously, though some questionnaires are not accepted, especially the one who do not fill up the content. Lastly, the gathered information are presented in well-mannered and well-written form, and the numbers included in the results are gathered in a graphical way.
And these significant findings were reported. First is the factors that could affect healthcare professionals during COVID-19 pandemic. The severity of sleep disturbances turned out to be significantly lower in the pre-pandemic period compared to the pandemic period. Two is the result outcome, as the researchers conducted a survey during pre-pandemic and during pandemic. And it says the pandemic period resulted in the exacerbation of depressive and insomnia symptoms among the healthcare professionals. On the latter part, the amount of social support is increased during the pandemic. 3. Other factors of healthcare professionals is based on their work or the situation they are facing. Depressive symptoms and insomnia became more severe during the pandemic among healthcare professionals, while social support also increased again. Alcohol consumption also increased during the pandemic due to the excessive stress, resulting in depression, insomnia, and increased alcohol intake.
For the recommendation of the study, the author have listed several limitations that could have affected the result and discussed some suggestions for improvements. The first limitation that the author acknowledged is that the survey assessing mental state in the past is prone to being biased. They have stated that there are no fully objective measures for evaluating depressive symptoms free of subjectivity. The respondents' subjective impressions of deteriorations or improvements in their mental state remains the most important outcome, and further, the cause of therapeutic intervention. The second limitation is that participants were asked about symptoms they had developed several weeks before the study. With this, there is a risk of inaccurate reproduction of information. But despite these concerns, none of the respondents reported problems with remembering their well-being in the period about which they were asked, and none of them reported problems with that issue. The author also recommended to use the longitudinal design of the study since it would be more appropriate and precise. But unfortunately, the course of pandemic did not allow that. Since the study used cross-sectional design, which was based on two evaluations carried out at the same time point, could also be a source of bias. Thus, it must be underlined that given the cross-sectional and retrospective nature of the current study, the outcomes should be interpreted with caution. The last recommendation was to take note different sources of bias that could have influenced the pre-epidemic assessment of the subject's mental state. Problems with remembering, the influence of current stress, and dread for the future are some of the examples that should all be taken into account when interpreting the results.
And that would be all for the study about COVID-19 pandemic influence on healthcare professional presented by Ms. Ariate, Mr. Fideli, Ms. Haron, Mr. Macabago, and Mr. Sudikin. Thank you.